why do we use bone conduction rather than air conduction for a given hearing aid? Well, there's a couple reasons for that. One could be related to congenital malformation or traumatic deformation of the structures that normally allow for coupling of the hearing aids. So, for example, if somebody is born with a craniofacial anomaly and they have oral atresia, they may not have an ear canal in order to couple an ear mold or a hearing aid to. So it may not even be an option. There may be somebody who has bilateral chronic otitis media, so that constant perforations of the eardrums as well as uh, exited present within the ear canal, and is going to create a problem for wearing an air conduction hearing aid. Um, they may that will also be related to constant fluctuating hearing loss. So the hearing aids would need to be constantly reprogrammed to take into account any changes in middle ear status. So that's one very common. Those are some very common reasons why you might use a bone conduction hearing aid. Traditionally, bone conduction hearing aids have used a headband with the bone conduction transducer placed on the mastoid, or they may have used eyeglasses again with the bone conduction transducer placed on the mastoid. So either the headband or the eyeglass frame would hold them in place. And there are some drawbacks to bone conduction hearing aids, though. The obvious one, especially with the headband, is cosmetics. Comfort can also be a major issue. And after continuous use of the bone conduction hearing aids, you can create indentations within the temporal bone.